Think breast cancer runs in families? Think again. 90% of women who get breast cancer have no family history. So if it's not genetics, what actually puts you at risk? I'm Dr. Christine Lai, a specialist surgeon working in the field of breast cancer. For over 20 years, I've cared for women just like you. My goal is to cut through the fear and bring you science-backed breast health information that you can use. Some risks you can't control, but some you can. Understanding them all, that's the first step. You may be surprised, or it may be obvious. Being female is the #1 risk factor for breast cancer. Yes, men can get breast cancer, but only 1% of all breast cancers diagnosed are in men. Here's something that's also rarely talked about. The other big risk factor for breast cancer is getting older. Why? As we age, our cells accumulate more DNA damage, increasing the risk of cancer. The more damage that occurs in cells, the higher the chance that the cells get mutation to evolve into cancer cells, and that's how cancer forms. This is why screening programs focus on women over the age of 50. A 50-year-old woman is 10 times more likely to develop breast cancer than a 30-year-old. But should younger women pay attention? Yes, and here's why. At 30, the risk of breast cancer in the next 10 years is 1 in 204. At 40, increases to 1 in 65, at 50, 1 in 42, at 60, 1 in 28, and at 70, the risk is 1 in 24 in the next 10 years. This is why routine screening is recommended from the age of 50 in most countries. Should younger women worry? Let's talk about that. If in your 20s or 30s, you might be overestimating your risk, but some women do need to start screening earlier. You may need to start screening earlier if you have a strong family history with multiple female members diagnosed with breast cancer, if there are certain genetic mutations like BRCA1 and BRCA2 in your family. These mutations can increase a woman's lifetime risk by up to 80%, but they're rare. If your mother, sister or daughter had breast cancer, your risk doubles. If you have 2 first-degree relatives, your risk trebles. You may need early screening if you have a strong family history with multiple female members being diagnosed with breast cancer. For everyone else, just being aware of your normal breast health is enough. You should seek medical review if you develop any breast or nipple symptoms. What do ovarian hormones have to do with breast cancer? A lot. The longer your body is exposed to ovarian hormones of estrogen and progesterone, the higher your risk. Having early periods before the age of 12 and late menopause after 55 both result in increased risk of breast cancer. But here's something interesting. Pregnancy and breastfeeding, they actually lower your risk. Women who have multiple pregnancies at a younger age tend to have lower risk for breast cancer, while women who have children or have their first pregnancy over the age of 35 may have a slightly increased risk. You can't control everything, but knowing these factors helps put your risk into perspective. Let's talk about a risk factor that's not in most conversations, breast density. If you have dense breasts, your cancer risk is over 2 times higher than a woman with average breast density. But the biggest issue with breast density is that dense breast tissue can mask cancer and make it harder to detect in mammograms. Why? Because dense tissue appears white on a mammogram, as does cancer. It's like trying to spot a polar bear in a blizzard. It's there, but it's hard to see. So if you have dense breasts, should you be worried? Here's the bottom line. Women whose mammograms state they have above average breast density should talk to their doctor about what their risk of cancer is and whether supplemental screening is appropriate. I've created a separate video on breast density which can be clicked above here. Breast density is not a guarantee you'll get cancer. It needs to be weighed up in the context of your risk factors for breast cancer. Which brings me to part 2, the biggest modifiable risk factors for breast cancer. Things you can change to lower your risk. And we were starting with one thing that surprises most people. Alcohol. Did you know that even moderate drinking increases your cancer risk? This surprises a lot of people. 1 standard drink a day increases breast cancer risk by 7%. The effects are greater in postmenopausal women. Alcohol does 2 things. It increases estrogen levels and breast density, and it also causes free radicals to damage DNA. But here's the good news. Cutting back your drinking can lower your risk of breast cancer. The other big thing is your weight. After menopause, being overweight increases your breast cancer risk by 20 to 40%. But here's the flip side. Exercise is one of the most powerful ways to lower your risk. Just 150 minutes a week, that's 30 minutes 5 days a week, can reduce breast cancer risk and improve overall health. Some women get diagnosed with breast cancer shortly after starting menopausal hormonal therapy, but does that mean the hormones cause cancer? No. It means the cancer was already there at a microscopic level and the menopause hormone therapy simply accelerated its growth. Let's talk about the evidence. Large randomised controlled trials, including data from the Women's Health Initiative, show that estrogen-only menopausal hormone therapy does not increase cancer risk. Some studies show it may reduce risk. The small increased risk comes from combined menopause hormone therapy with estrogen and progesterone. And here's what's really talked about. Menopause hormone therapy started under 60 lowers the risk of cardiovascular disease, which is the #1 killer of women. So before making a decision based on fear, it's important to talk about the full picture with your doctor. So if you're wondering, what does this mean for you? 1, get screened. If you're over 40, don't skip your regular mammograms. 2, know your risk. If you have a strong family history, talk to your doctor about getting a detailed risk assessment. And 3, make small changes. Remain active, maintain a healthy weight, and if relevant, reduce your alcohol intake. And most importantly, don't panic. A 40-year-old woman with very dense breasts has a risk of approximately 3% over 10 years, not 50%. This is still less than the average woman over the age of 60. Perspective matters. It's about making informed choices, not living in fear. That's why I do these videos, to help you understand your risks, your screening options, and what you can do to stay healthy. Still have questions? Drop them in the comments and I'll answer them. And if this helped you, hit like, share and subscribe for more science-backed breast health advice.